Hi, good evening, and welcome back to this session on most frequently asked essay questions in exams. Every Tuesday, we discuss about very frequently asked long essays, short essays questions in the university exam. And Thursday, we start with the discussion of histology slides. So, welcome back to this session again. What we'll do today is we have discussed series of long essays starting from week 1. This week, we'll do it slightly differently. We will discuss about two important short essays that are very frequently asked in exam instead of a long essay. And we'll see how to write answers if this comes as a short essay or a 5-marker question. Kindly pardon me for my voice. I have a very bad laryngitis. Uh, so, from embryology, one question that is very frequently asked in your university exam is the development of tongue. The second topic that is related to this is the nerve supply of the tongue and its embryological basis. We will try to solve both of these questions today. First, let's start with the question on the development of the tongue. Very often, embryology questions are felt difficult by the students because most of the time we do not know under what headings we should describe the development of any particular structure, right? But there is a fixed template that we can use. Always start with what is the timeline when the development happens. The second one is what are the embryological sources. The third one is uh, the process. Fourth one is the clinical or developmental abnormality. So if development of the tongue is asked, what is the first uh, heading that we use? So when we start answering the question, remember, first use the heading of timeline, right? When does development of tongue occurs? So remember, development of tongue begins, right? This begins at the 4th week of intrauterine life. This is the first thing. Your examiner will be impressed if you can write the timeline, especially in embryology. The second thing is the source. Now, regarding the source, the development of the tongue is slightly peculiar. So, first is development of the mucosa. Second one, development of the muscles. Then the third one, development of the connective tissue. The mucosa develops from lingual swellings, right? Lingual swellings that come from pharyngeal arches. This we will see how. Muscles develop from occipital myotomes, right? And then connective tissue develops from the mesoderm of the head and neck region. If you can write this much regarding the source of development of the tongue, nothing like it. So always make a beginning with what? The timeline. The second thing, mention the sources. What is the third heading that I said? The process. Usually maximum marks will be allocated to this. So if it's a 5-marker, at least 3-marker or 2.5 marks will be allocated to the process. Done. Now, let's try and understand how exactly the tongue develops. So what we can do here is we can actually repeat the tongue develop from occipital myotomes, connective tissue develop from the mesoderm of head and neck. What we need to explain is the development of mucosa, and this we need to mention in detail. So let's try and understand how tongue develops by looking at some of the images. This is the diagram of the primitive pharynx with the pharyngeal arch, cleft, and pouch, and then the primitive pharynx. In the floor of the primitive pharynx, right, the development of pharyngeal arches gives rise to mucosa. How exactly? Let's try to understand. So when we talk about mucosa, right, the mucosa takes its origin differently from anterior 2/3, then posterior 1/3, and then the posterior most part of the tongue. Done. So how does mucous membrane of anterior 2/3 of the tongue develop? Remember, the first, this is the first pharyngeal arch, right? The first pharyngeal arch gives rise to one median lingual swelling, right? As we can see, this is the median lingual swelling. Sorry, those are lateral lingual swellings. This is the median lingual swelling. The second one is the lateral lingual swellings. All three will take their origin from the first pharyngeal arch. Are we clear? Median lingual swelling and two lateral lingual swellings. Posteriorly, as we progress, the second arch gives rise to a small component called as copula of His. Ultimately, this component gets buried by the overgrown third and the fourth arch, which gives rise to a combined swelling, as we can see here. And what do we refer this as? This is a hypobronchial eminence. Are we clear? Done. Now, remember, at the junction of the first arch, third and the fourth arch, there persists a foramen, which is called as foramen cecum, or foramen cecum of the tongue. Done. These are some of the preliminary events. So how does mucosa of anterior 2/3 develop? This develops from two sources again. What are they? The median lingual swelling and pair of lateral lingual swellings. So median lingual swelling and lateral lingual swellings, when they unite, they give rise to formation of anterior 2/3 of the tongue. How does posterior 1/3 come from? This comes from hypobronchial eminence. So does the posterior most part. If we can see, the ventral part gives rise to the posterior 1/3. The dorsal part gives rise to the posterior most part of mucosa of the tongue. So what happens in next stage? As we can see, the lateral lingual swellings grow towards median lingual swelling. The hypobronchial eminence start growing towards the median lingual swelling and covers the copula of His, which gets buried. Now what happens is, this hypobronchial eminence will split into a ventral part and a dorsal part. The ventral part will give rise to the posterior 1/3 of mucosa of the tongue, whereas the dorsal part of the hypobronchial eminence will give rise to the epiglottic vallecula and part of the epiglottis as well, as we can see in this image. So we have the anterior 2/3 of the tongue, right? The two medial lingual swellings, when they unite in midline, they form the midline groove, where the anterior 2/3 and posterior 1/3 meet. We have a V-shaped groove, and this is called as the sulcus terminalis. The sulcus terminalis, at the junction, we have an opening which is called as foramen cecum, from which the thyroglossal duct develops. Correct? Are we clear? So, mucosa of anterior 2/3, how is it derived? From the first pharyngeal arch by means of median lingual swelling and two lateral lingual swellings. How does the posterior 1/3 and posterior more part develop? Posterior 1/3 occurs by the overgrowth of the ventral part of the hypobronchial eminence. The dorsal part of the hypobronchial eminence will persist as the epiglottic vallecula, median glossoepiglottic fold, as well as the epiglottis. The muscles, one single sentence, occipital myotomes. The connective tissue stroma, again remember, it develops from the connective tissue of mesoderm. This is how you should explain the development of tongue. A very important 5 marker. We have seen this question being asked every alternate year or even every year. Now, if asked, this is a important 5 marker question. Done. What about the second topic that we need to discuss? The second topic is, let's imagine the nerve supply of the tongue, right? Nerve supply of the tongue, one, along with the nerve supply, describe the embryological basis. So this is like we are asking the nerve supply, then we are also asking what is the embryological basis behind the nerve supply of the tongue. So partly gross anatomy, partly embryology. How? Let's explain. So when we discuss nerve supply of the tongue, I would suggest simply write it as nerve supply. So first, the motor nerve supply, and then divide it into sensory nerve supply. You have the answer already. The motor nerve supply is by hypoglossal nerve. Done. This is correct. What about, so here there is a catch. I'm sorry. When we talk about hypoglossal nerve, this supplies all muscles of the tongue, right? All muscles of the tongue except plateauglossus, which is supplied by cranial axillary nerve. You can write it or just leave it off. But remember, all muscles of the tongue are supplied by only one nerve, that is hypoglossal, except for plateauglossus. How do we explain sensory innervation? Remember, the sensory innervation is further grouped as the general sense, and then we have the special sense. What about general sense? Remember, divide it as anterior 2/3, posterior 1/3, and then posterior most part of the tongue. The special sense also divided into anterior 2/3, posterior 1/3, and posterior most part. Once we write this, how do we go on explaining? Anterior 2/3, the nerve of general sense is the lingual nerve. Remember, this is branch of mandibular nerve. How about posterior 1/3? Posterior 1/3, remember, this develops or this is innervated by the glossopharyngeal nerve. Posterior most part is by the vagus nerve. Done. So this is regarding the general sense. What about special sense? In fact, this is your internal laryngeal nerve. What about taste sensation? Special sense includes taste, and anterior 2/3, this is by the chorda tympani. Remember, chorda tympani is a branch of facial nerve which ultimately joins the lingual nerve, carries two types of fibers. One fiber to the tongue, to one fiber to the submandibular and sublingual salivary gland to secrete saliva. The other part of this nerve, right? Uh, sorry, chorda tympani comes from the facial nerve and this joins the lingual nerve before supplying the tongue. Chorda tympani carries two types of fibers, secretomotor fibers to submandibular and sublingual gland, as well as carries the taste fibers from anterior 2/3 of the tongue via lingual nerve. What about posterior 1/3? Posterior 1/3, it is innervated by the glossopharyngeal nerve, and posterior most part is by the vagus nerve, which is the internal laryngeal nerve again. Right? Are we clear? So this is how muscles of the tongue, the mucosa of the tongue are innervated. If nerve supply of the tongue is asked, this is what you write. Now, what do we mean by embryological basis? So we are talking about embryological basis, right? So the first one is the occipital myotomes, right? Gives rise to the muscles, and these muscles are innervated by what nerve? Hypoglossal nerve. Why? Hypoglossal nerve is the nerve of, it is the nerve of the 12th arch. sorry, hypoglossal nerve is the 12th cranium. Done. And hypoglossal nerve is the nerve of occipital myotomes. What about mucosa? If we see anterior two-third is innervated by the lingual nerve, it also includes chorda tympani. But this tells us that chorda tympani fibers cannot reach the anterior two-thirds directly, so they reach through lingual nerve. Right? Why is this? Lingual nerve is the nerve of the first arch, and as we know, the first arch will give rise to anterior two-third mucosa. What about posterior one-third? Posterior one-third develops from the third arch mainly, and hence it is innervated by glossopharyngeal nerve, which is the nerve of the third arch. What about posterior most part? Posterior most part comes from the fourth arch, and hence it is supplied by the vagus nerve. Are we clear? So this is how we should explain the nerve supply of the tongue and its embryological basis. Anterior two-third is supplied by lingual nerve because anterior two-third comes from the first arch, and first arch nerve is mandibular nerve. Lingual nerve is a branch of the mandibular nerve. What about posterior one-third? Posterior one-third develops from the hypobronchial eminence, which is derived from the third and fourth. The ventral part of the hypobronchial eminence gives to the posterior one-third. This develops from the third arch, and hence it is innervated by glossopharyngeal nerve. Whereas the posterior most part of the tongue develops from the fourth arch, and hence it is supplied by the internal laryngeal branch of vagus nerve. Done? Here, I just want you to add a note. Okay? Now, if we recall the anatomy of the tongue, it will be like this, right? So we have foramen cecum. We have large villi here, which are called as circumvallate papillae. Then multiple fungiform and filiform papillae and folate papillae. Right? This is the basic arrangement. The glossopharyngeal nerve not only supplies the posterior one-third, but the circumvallate papillae, these are also innervated by glossopharyngeal nerve and not by which nerve? Anteriorly, the taste sensation carried by chorda tympani, right? So even though circumvallate papilla is present in anterior two-thirds of the tongue, they are innervated by glossopharyngeal nerve and not by chorda tympani, which is from the facial nerve. Right? The reason for this again lies in embryology. The circumvallate papilla take their origin from the third pharyngeal arch, and nerve of this arch is glossopharyngeal nerve, and that is why circumvallate papilla, even though they are present in anterior two-thirds, they are innervated by the glossopharyngeal nerve. Right? This is regarding the development of the tongue and the nerve supply. If we want to close the development of the tongue, what are the other headings that we should be writing? So remember, the last one could be developmental abnormality. In developmental abnormality, the most commonest abnormality we get is ankyloglossia, which is otherwise called as tongue tie. Why does tongue tie occurs? This occurs because of shortening of frenulum of the tongue. Then there can occur bifid tongue. Actually, bifid tongue is a characteristic feature of reptiles. You have snakes with bifid tongue, right? So can you tell me what will happen in bifid tongue? The two lateral lingual swellings fail to fuse. Correct? So this is what we call as bifid tongue. The third one that we can think of, right, is agenesis or so there is agenesis, which is complete absence of tongue, or microglossia, when the tongue does not develop fully, then macroglossia, where the tongue is abnormally huge. Are we clear? So this is how you should mention about the development of the tongue if asked. So remember timeline, then the source for each of the layers, then the muscles, right? So timeline, source, process, and developmental environment. This is how we should describe the development of the tongue muscles, okay, or the tongue as a whole. Done. As I said, a very important short essay question for your exams. Make sure you revise it again, right? If there are any doubts, I would love to answer doubts now. Okay. If there are no doubts, we'll come back with one more important uh, question for next Tuesday. Thursday, we will have a question from the histology slide discussion. Okay, we started with esophagus last week, if you remember. We will discuss about the slides of stomach, the funding part and the pyloric part on Thursday. Thank you.